right. What is the most likely underlying mechanism for the patient's arrhythmia? So a cardio, I think here, 56-year-old woman with a history of hypertension and diabetes presents to the emergency department with palpitations and shortness of breath for the past 4 hours. She denies chest pain or syncope. Her blood pressure is 125/80. Heart rate is 150 beats per minute. O2 sat is 97. Physical examination reveals irregular pulse and a 12-lead EKG, so sawtooth pattern of P waves with 300 beats per minute and a ventricular response of 150 beats per minute. Okay, so right away I'm thinking with the irregular, um, AFib. So let's see. The sawtooth pattern, I was also thinking of it's like the one that's near AFib, but I can't think of the name of it. Let's see. Um, what is the most likely underlying mechanism? So re-entry, abnormal automaticity of the ventricles, re-entry in the atria, triggered by activity in the atria, abnormal automaticity of the atria. So I think atrial fibrillation would be, I don't know what the mechanism, I guess abnormal automaticity in the atria as opposed to the ventricles, even though the ventricles both make sense. Let's see. Beats per minute with a ventricular response. It's just out of sync. I don't think it's a triggering. I don't think it's one triggering the other. I think they're just out of sync. I don't think it's re-entry, but I could be confusing this stuff. It's almost like a mechanism of pathology that. Hmm. I was thinking the atrial flutter, which I think is irregularly regular, but this is irregularly irregular. Abnormal
Your guts.
automaticity. I think I do abnormal automaticity, although I'm really not super confident.
Okay, let's work it here.
Okay.
So I think that I think you work through it like consistent of atrial flutter or
Oh,
AFib,
okay. Oh,
and
it's
then
flutter.
A
Okay.
flood. Well, mainly because the sawtooth is a little bit
That's what
better.
I thought. I'm like, I don't think the other one has a
Mm-hmm.
sawtooth, but okay.
Remember, AFib doesn't have P waves, right? Something you can remember.
Right.
Okay. Atrial flutter consistent with re-entry circuit within the atria, most commonly involving the cavotrispus ispid in the right atrium. So
Okay.
nothing crazy. You just have to kind of add now because I think you had the diagnosis, which I'm good with. So then you
Okay.
have to just add a factoid, which is in a sense it's caused by the
Re-entry.
entry
Okay.
circuit. Yep.
Okay.
So re-entrant with the AV node is a mechanism for AV nodal reentry tachycardia, which
Okay.
regular narrow complex tachycardia, and then abnormal automaticity for the ventricles is ventricular tachycardia, which is wide complex tachycardia, and
Okay.
then triggered activia is atrial tachycardia or atrial fibrillation. Okay, so that's good to know. Abnormal automaticity is underlying for atrial tachycardia, which presents in regular, narrow, complex tachycardia. So
Okay.
yeah, just things to add into your kind of your book, but you got the diagnosis, so that's 80% of the question. So
So flutter's re-entry and then AFib is triggered
it seems like
activity.
it's triggered activity.
Okay.